Good morning, everyone. Welcome to the second presentation of the Hidalgo County Wellness Program 2021 Virtual Wellness Fair of the second day. My name is Diana Hualpa with the Hidalgo County Wellness Program, and I'm really excited that you joined us today. Before we get started, we want to make sure that the technology is working for us. Therefore, if you can see the slides clearly and if you can hear my voice clearly, please click on the raise hand icon that is located at the bottom of our Zoom webinar software. Again, if you can see the slides clearly and if you can hear my voice clearly, please click on the raise hand icon that is at the bottom of our Zoom webinar software. Thank you so much. It looks like we're good to go technology-wise. I do have a few reminders before we get started. And reminder number one is that we do have 4 additional presentations as part of our Hidalgo County 2021 Virtual Wellness Forum. Therefore, I do invite you to subscribe to our upcoming presentations and to set up reminders for them. You can do so through our Hidalgo County Wellness Program website or through the Hidalgo County Wellness Program Fair website as well. The second reminder that I want to make sure that we inform you is that you are on listening only mode. However, you are able to submit your questions via our Q&A forum on our Zoom webinar software throughout the presentation, and we will be more than happy to answer them at the end during our Q&A session. At this point, I do have the pleasure of introducing our guest speaker for today's presentation, Dr. Maria Colón-Gonzalez. Dr. Gonzalez graduated from the University of Puerto Rico Science Medical Campus, School of Medicine, completing her residency at Penn State and her fellowship at Brown University. Dr. Colón-Gonzalez decided to join the University of Texas Rio Grande Valley as an assistant professor in the Department of Family and Community Medicine. Her experience in the Rio Grande Valley includes working in urgent care, occupational health, telemedicine, and primary care. She is passionate about empowering patients as agents of their own health via holistic care. And she's currently the lead provider at Vera Whole Health Edinburg Care Center. Without further ado, I'll pass it over to you, Dr. Colón. Good morning.
Good morning, all. I'm going to share my screen.
Perfect.
So that we can get started. Are you all able to see my screen well?
We are able to see the screen. We're currently on the, there we go. It's perfect.
Sounds good. So welcome. My name is Dr. Colón. As Diana said, I am the lead provider at the Edinburg Care Center. And how is it that Vera Whole Health provides healthcare that is different than other, than in other clinics that you might visit? So, the first thing is that we think about designing the care center around our patients. So Vera believes in delivering empathic care, and we also believe in taking the time to listening to our patients and to their needs so that we can address them without you feeling that you're being rushed, out of the room or rushed out of the door. Another important thing is that using the care center and receiving healthcare services does not have an additional cost for Hidalgo employees or for your dependents that are within the Aetna healthcare plan. So why Hidalgo County is bringing you Vera Whole Health? First of all, it's a win-win, right? So it's a win for you as a patient because it reduces your cost to you and to your family. It also reduces medical plan costs for the county while you're receiving excellent care for you and for your family members. So how does it work? Well, the Vera Care Center is one of the additions that you have to your benefits. And the best way to get started is to schedule your annual whole health evaluation, or what is also known as your preventive wellness exam. I always like to remind all of my patients that all the care that you receive here at Vera is completely protected by HIPAA. That means that your information is secure and private, and your employer does not have access to this information. So how is the annual whole health evaluation different, right, than the care that you might receive elsewhere? So the first thing is that during this evaluation, right, you will receive a health assessment that will be done by my care team. You will complete a biometric screening, and then you will have a visit with one of our providers. So that would be me or our nurse practitioner, Rebecca Garza. And finally, you have what is called the coaching connection. So this is a comprehensive visit where we do an in-depth history, and we get to know you as a person and not only your medical conditions. And then we're able to discuss your assessment in terms of where your health is. And that's really what we call the biometrics. You receive a full physical exam. After that, you know, we might decide if we need to do extra type of testing or treatments. And then finally, you meet with the health coach, which is the key in helping you achieve your healthcare goals. So part of what you get to do at Vera, or some of the benefits of coming to the Vera Care Center, is that you save time, right? If you need other care, we will coordinate and we will follow up with the providers that we coordinated with that specialty care. You will have no wait times or little wait times compared to other places that you might go to receive your care. And remember that our care team is always ready when you arrive to the care center so that we can serve you best. You also get to save money. And one of the ways that you get to save money is due to our on-site labs. So you do not need to travel to an outside lab to have your blood drawn. And there are 0 copays for you at this office. So we focus on preventive care, and that is our annual whole health evaluation. We do adult wellness exams, and that includes your comprehensive women's health exam. We provide with the vaccines, and we also do health screening. You can also come to Vera for your chronic care management. So for conditions like diabetes, hypertension, hyperlipidemia, right, high cholesterol, depression, and anxiety. You can also come to your Vera Care Center for what we call acute care. So think about your common coughs, colds, sore throats, urinary skin infections. At Vera, you also get access to a healthcare coach. We have on-site labs, and remember, we coordinate the care for you. And all of these services are at 0 copay and no deductibles. So this is our Vera Care Center. As you can see, we have a small patient registration area, but this is because part of what we want is for you not to have to spend an hour sitting down waiting for your appointment. As you can see, our exams rooms are big, are comfortable, and we do everything there right at your exam room. So you do not have to move around or walk around a lot. We have our health coach on site, and we have our labs on site, as I said. So remember that our office hours are Monday, Wednesdays, and Fridays, 7 in the morning to 6 p.m. and Tuesdays and Thursdays, 7 in the morning to 7 p.m. And you can always call the care center to schedule your appointments. Our phone number is 956-287-3099. And if you visit our Vera Care Center here in Edinburg before December 31st of 2021, so before the end of the year, you can earn a $200 incentive for all eligible employees who book their wellness visit, right? Their annual whole health evaluation, or what we call the preventive wellness exam, before December 31st of this year. And this will be a $200 credit towards your 2022 deductible. So all the employees, spouses, and dependent covered under the county's Aetna medical plan can come and visit your Vera Care Center and can receive services here. Thank you. Do you have any questions for me?
Thank you so much, Dr. Colón. At this point, I'm going to go ahead and share my screen. That way we can go ahead and start the Q&A session. And there are questions coming in. I do want to remind our employees that we do have this time allocated to answer any questions that you may have regarding the Vera Whole Health Edinburg Care Center. So let's go ahead and start with the first one. Did you administer COVID-19 vaccines?
Yeah, so currently we do not have the COVID vaccine available. We can definitely coordinate with your pharmacy of preference.
Okay, perfect. And the next question is, does the 200 credit apply to employees who have already been using Vera?
Yes, so my understanding is, and Diana, correct me if I'm wrong, or Joanne, if you are in the, I know that you are here, is that if you have completed your preventive wellness exam, so that annual whole health evaluation, then yes. If you, for example, have, used a Vera Care Center because you were sick, maybe you needed to be tested for COVID, but you have not returned and you have not completed that whole health evaluation, then you would not be receiving those $200 credit.
And that's correct, Dr. Colonna. I think you explained it perfectly. So basically, it is for employees that are Vera patients, but that they have done their well-being exam, so their annual physical exam. And there's still times that we definitely encourage you to schedule the appointment, call the call center and schedule that well-being appointment so that we can get your physical done and you can maximize this new benefit that it was actually just approved a few months, not even a few months, I think it's only 1 month ago. So we're super excited that we have partnered with Vera Whole Health to provide you with this additional benefit when you are going to get those 200 credits towards your deductible. The next question that we have is, are the labs done there and how long until lab results are returned?
Yeah, so it depends. We do have what we call some point of care labs. So that includes your A1C, your lipid panel, some urine tests, and of course, things like strep, COVID, flu. Those we get pretty quickly. So, within 15 minutes of your visit. If it's something that we do need to, what we call like send to Quest, it will really depend on the lab, right? So for example, something like a pathology, because I did a biopsy or a pap smear, that can take up to a week. Other blood tests, we might have them back the next day. It will really depend on the blood test that we're ordering.
And I do want to emphasize that because Vera is also working with our county's medical insurance, we always ensure that we send them to labs that are in network and especially to our preferred labs. So Quest Diagnostics being one of them.
Yes.
The next question is, what is the wellness exam? Can you elaborate a little bit more on the wellness exam?
Yes. So in the wellness exam, the first thing that the patient will do is complete a comprehensive history. And when I mean a comprehensive history, it not only asks you, questions related to your physical health. So like, are you having any symptoms or are you taking any medications? And do you have any medical conditions? But then it also goes into assessing your mental well-being, your healthcare goals. We also assess for use of what we call risky substances, so tobacco, alcohol. We talk about your sexual health as well. So it's a very comprehensive, intake. It also lets us know what type of preventive exams and vaccines you have completed versus, to which ones you might be due for. After you complete that, while my medical assistant is rooming you in, we are actually reviewing that intake so that I kind of like know a little bit more specifically of like a little bit about you right before I go into the room. And in the meantime, my medical assistant is completing what we call the biometrics. So in the biometrics, they do, your vital signs, and that includes a waist circumference. The A1C, which is the test that we do that lets us know where your sugar has been in approximately the last 3 months, as well as what we call a point of care sugar test, which we can use together with the A1C to know, could you have diabetes? Could you have pre-diabetes? And where do we need to focus? And then we also do a cholesterol panel. We ask you about physical activity, smoking history, and we put all of this information into a validated calculator from the American College of Cardiologists to also predict, right? This calculator helps us predict your risk of having a heart attack or a stroke in the next 10 years. And that's also one of the things that we use to focus, right, in the areas that perhaps we can help you so that we can prevent, things like diabetes, heart attacks, strokes, because that will keep you healthy.
Absolutely. Thank you so much for answering that question. And I do want to add, just from the patient perspective, for example, because I just recently went to actually visit with Dr. Colón and have my wellness exam. I think one of the things that I really value about going to the care center is the time that, in this case, the physician or the nurse practitioner who is seeing you takes to actually talk to you and get to know you. And that's something that I feel that it sometimes in other care centers here in the States, it's something like quick and fast, like as soon maybe 5 minutes, 10 minutes at the most. But we actually take the time, and Dr. Colón takes the time to get to know our family history, get to know what are our concerns, because maybe there might not be medical problems, but there are things that are going on in our mind or that concern us, and definitely she can guide us and support us and providing us the resources that we need. So that's something that I really appreciate, Dr. Colón, when I visit with you. But we do have more questions, so let me go ahead and go to the next questions. If we are needing to see a specialist, will the Vera Clinic refer us to a specialist in network?
Absolutely. So we have the list of what we consider, what Aetna considers high value network, and we try to keep our referrals within that, unless, right, the patient has previously seen, a physician, a specialist in that area, and they want to continue to see that physician. Or, they might have a family member, a friend that recommended a specific physician that they might want to see. So we definitely will keep you within that high value network unless you do have a specific request. So yes.
Perfect. And the next question that we have is, does the care center do the rapid COVID testing?
Yes, we do have the rapid COVID test available. The way that, we're doing our visits is that, so you need, to have an evaluation or a visit with one of the providers. We're doing that virtually. So whether it be via video or via phone. And then we schedule you to have, the test done. We're doing it curbside, right? So one of my medical assistants will go to your car and we'll do the swab. And it takes about 15 minutes for us to have the results. So you will have the results the same day. We will call you. We will let you know what the results are. And then based on the results, what the plan of care should be.
Thank you so much, Dr. Colón. And the next question that we have is, if I already have a primary care physician, can I still visit the care center in the case we're unable to obtain an appointment with my PCP?
Absolutely. So let's say, right, that you woke up with a cough on a cold, or maybe you woke up thinking, for female patients that they have a UTI. You can always call the care center and we will gladly see you for those concerns.
Perfect. Thank you so much. The next question that we have is, can we be seen at the clinic or virtually?
Yes. So, so here at Vera, we have the capacity to see you in person via video or via telephone. Now, specifically, we are also doing COVID screening questionnaires, right? So if we have a patient that answers positive to one of those questions, right, affirmatively, for example, they might be having a cough, which sometimes I understand is not COVID related, but we still have a protocol in place where we will, if you wanted to come to the care center in person, we will convert that to a telephone visit or to a video visit, virtual care, but we are, yes, seeing patients in person as well.
Perfect. So both options are available, in person, yes, and virtually. Perfect. Thank you so much. The next question that we have is, am I able to take my teenagers in to be evaluated for school required physicals to participate in sports?
Yes, we do complete sports physical, right? And we can see your, any pediatric patients, so any kid that you might have starting at the age of 3 years of age.
Perfect. Thank you so much. The next question is, can we schedule an appointment online, or do we need to call to schedule an appointment?
You can do it both ways. If you already have access, to the patient portal, you have been here before, you have completed the process, you can schedule it online. If you have never been to the care center, perhaps you still do not know how to use the patient portal, how to schedule it, you can call and request an appointment.
Perfect. Thank you so much. And the next question is, if we are sick, can we do a walk-in appointment?
Yeah, so our appointments are, but per visit, right? So we have, they're per visit. That does not mean that if you're sick, right, and you come into the office that we're going to tell you, oh no, we cannot see you. What will happen is that, we will look at our schedule because every patient has their appointment. Because remember, we want to dedicate our time for you. So those 30-minute slot or that 1 hour slot is dedicated to you. And what might happen is when you come in, we might tell you, our next available appointment might be at 10 in the morning, at 2 p.m., so that we can schedule you. It might happen that you walked in and, hey, we didn't have no patient already scheduled at that time, and we can see you right then and there. But we work by appointment, so we prefer, to have you schedule.
Definitely. And I think one of the main things that we definitely also want to encourage our employees is that, for example, let's say that you would like to have an same day appointment, because they are available and there's spaces that are dedicated, blocked for same day appointments. You do call as soon as possible, early in the morning. That way they can put you in the schedule.
Yes.
The next question that we have is, do you have counseling at the Vera Clinic as part of your no copay service?
Yes. So right now, I'm guessing that when they're talking about counseling, it's behavioral health counseling. So like seeing a therapist. So right now, the way that we don't have it available in-house, it's not one of the services that we provide, but we do coordinate. The first thing that I always offer one of my patients is, I restate you have access through the employee assistance program, because I know that won't be at an extra cost for the patients, right, for the employees. And if that is not an option, for various reasons, right, is not what the patient might prefer, then we do coordinate with a therapist within the community that they can see. There might be things, depending on what are the needs, that our health coach, might be able to address. So let's say that this is a person that perhaps what it needs is to learn some relaxation techniques, right? That's something that our health coach can do here. So there might be things that we might be able to do in the care center versus somebody that needs a more dedicated therapy, because it's a little bit more complex, the issues that are going on, that yes, we'll definitely need to see a therapist.
Perfect. Thank you so much. The next question that we have is, how do you handle emergencies and acute care?
Yes. So let me see perhaps if I can provide a good answer to that. So when we talk about an emergency, I'm not sure exactly, if they mean an emergency that starts or happens here in the care center. But let's say that, you call, right, the care center and you tell them that you're having chest pain. There is a couple of questions that they will ask you, because if we think that the chest pain that you're having is due to a heart attack, right, you're better off going straight to, the emergency department, or depending on where you are, calling 911, because that can be life-saving. Versus if you come here, you're having a heart attack, there's not a lot of help, right, that I can provide for you. Now, let's say that is somebody that comes to the care center and while being here, right, starts to develop problems. So all of my staff is trained on how to handle emergencies. There's always, what we call like a leader, right? So that leader might be myself or might be the nurse practitioner. And we are the ones who are, in a way, giving the orders, like as classical say, like in the hospital, this is what everybody needs to do. And, the rules are appropriate, right? We have had patients that we have called, the emergency like 911, and we have done everything that we can here at the care center while 911 arrives, and then we transfer them specifically to the hospital, and then we coordinate the continuity of care for them to come back to see us.
Thank you so much for that question. The next question that we have is, if we have a primary medical doctor, can we still be seen at your office? And will the information be forwarded to our primary doctor?
Yes. So yes, if you have another, primary care provider, you can still come. For us to forward the information, we still need your consent, right? So you would need to sign that consent of that release of records, giving us permission to share the information, and we will gladly send it to your primary care doctor.
Perfect. Thank you so much. The next question is, does the clinic offer fertility examination?
Did you say fertility examination?
Yes.
Yes. So fertility examination, right, or to assess in terms of, are you having problems with your fertility and where that's going on? That's a little bit more of a specialty care. So whether it be for female patients or male patients, there might be some things that I can do here, right, in terms of like the basics and like the basic hormones and endocrines. But there might be, a point where I do need to refer you to that specialty care that will be able to provide you with the care that we cannot do here, just because of the limitations, right, that we might have.
Okay, thank you so much. The next question that we have is, if we request a screening on our B12 levels, can that be done?
Yeah, so that's a really good question. There are some reasons, right, where we might need to check your vitamin B12 level. Now, what we do know, right, is that for the majority of the healthy population, checking on the B12 level is really not going to provide us with good information in terms of how to help you, or what, how we would be able to use this information to make you healthier. So that's why I call a more tailored and a specific exam. And what I mean by that is that might be a test that I might need to do, for example, for a patient with diabetes that has been on metformin for a long time, or somebody that consumes a lot of alcohol. So there are certain type of conditions, medical conditions, that yes, we do need to look at the vitamin B12 level, but it's not necessarily for the entire population. So that's something that, if it's a concern that you have, I would say let's discuss it, whether it be with me or with Rebecca Garza.
Okay, thank you so much. And the next question that we have is, can a pregnant woman still go see you just to do a regular checkups, or just stay with the OBGYN?
Absolutely, right? A patient, a female patient that is expecting, they can come and visit our care center. We will not be able to do their obstetric care, right, and deliver their baby, but we can still do your preventive exams. If you have a medical condition that needs to be managed during pregnancy, like your blood pressure or your sugar or your thyroid, we still can do that here. If you're pregnant and you get sick, right, you develop a strep throat or flu or COVID, we can still take care of you here at the care center for those needs during your pregnancy.
Thank you so much, Doctor. And I do believe that we have time for one more question. So, and I know Ms. Joanne already responded via the chat, but just want to make sure that everybody is aware of it. How can we find out if we have done our wellness check and our health assessment?
Yes, so I'm guessing that the question goes towards that annual health evaluation, or what we call the preventive wellness exam. So one is you can call the care center and verify that. Second, if you ever remember having a visit where they did that it took long, that we did that biometrics, that you got this paper that I usually use like my markers and writing colors, and you take it home, then that is your annual health evaluation. That is your preventive wellness visit. And then, just as a clarification, right? We have that information available and we are sharing it with the county. So if you did complete it, you will receive your incentive.
Thank you so much. And that's actually a really good point, because we are still doing the $25 incentives additionally to the $200 incentive that is going to be done next year. So if you have done that and you're done your health risk assessment, you will get that via email, and that's from an Aetna email. So it doesn't come from the county, it doesn't come from the clinic, it comes from the Aetna or medical insurance carrier. And it does take from 4 to 8 weeks. So just be mindful of that time gap. Sometimes it's a little bit shorter than that, but it might take a little bit longer. So just so we make sure that the employees have that information. And I do have a couple of comments. They are not questions, but I do want to read them to you, Dr. Colón.
Sure.
The first one is, I do not have a question, but a compliment to the clinic. I'm a patient, and after so many issues for years, they finally were the ones who got what was wrong with me. Thank you. And the next one is, everyone is so helpful. So thank you.
Yes, thank you for those comments. We try our best, right, to serve all of the patients, with equity, right, to treat you with honor, to treat you with respect, right? And my team is here to help you. We want you to be healthy and enjoy life.
Absolutely. And there's one more question that I do want to cover. It's more regarding the incentive, so I'll go ahead and take that. I had my checkup and I got my card, but I never redeemed my card. Does that have an expiration date? So it does have an expiration date, but I believe it's like 2 years. So you still have time, especially if you did it this year, there's still time for you to do it. There's multiple options. So basically, once you receive your email, it's going to take you to an Aetna portal, and you're going to be able to see all the different options that you can redeem. So there's Sephora, there's some restaurants that you can also get that, or you can actually request that gift card to, instead of being used online, you can actually request a physical one. So there's just different options that you can request, and we definitely want to make sure that if you have any questions regarding that, make sure that you call the Aetna customer service, and they will be more than happy to help you with that. Or again, the Employee Benefits Division will be also be able to help you. Or the wellness program, of course. Perfect. Well, I think we have covered most of the questions. I hope that the employees or the attendees joining us this morning make sure that they make their appointment to receive that $200 incentive for the wellness program, wellness exam that we have. And that if you have any questions, please feel free to always reach out to the clinic or to the wellness program or Employee Benefits Division, and the three of us will be more than happy to help you. Thank you so much for being here with us, Dr. Colón. Thank you.
Thank you for the invitation, Diana. May you have a wonderful day.
Thank you. And thank you to everybody. We do have a presentation at 11 a.m. So I hope to see everybody there. Stay safe and stay healthy and have a beautiful morning.
Bye.
Bye.